Behind every successful person is a woman. And the most important woman in my life is my mother. A woman goes through a lot in her life, and her body changes according to time. Menopause is probably one of the toughest phases in life a woman has to go through. But it doesn't always need to be that way. Dr. Ong is here to share with us more.
Menopause really means end of periods, and therefore there's no further production of the female hormone called estrogen. Asian women particularly complain mainly of headaches, and they also complain of joint pains, body aches, as opposed to the Western women who mainly complain of hot flushes. Basically, menopause can be classified into two groups. One, we call it natural menopause. Now, under natural menopause, if a woman menopauses below the age of 40 years, we call that premature menopause. Okay? Now, if at about 55 years of age they still have not reached menopause, we refer to that as delayed menopause. Those women in between will therefore actually be classified as natural menopause. We know from so many studies, if a woman lands up with premature menopause, they are at higher risk for two main problems that also occur during natural menopause. One will be heart problems, heart diseases, or what doctors call cardiovascular disease. Number two, their bones will suffer more from a condition called osteoporosis. So they had a higher risk than the woman who goes into natural menopause. Now, any woman who goes into delayed menopause has the risk of getting womb cancer. One of the significant long-term issues is the increased risk of heart attacks. Menopausal women who are not treated die more from heart attacks than from cancer. The second issue we are worried about is the issue of that can make the patient suffer from bone pain, and if she falls, she may get fractures. And we are mainly concerned about hip fractures in older women. This can really make them bedridden. The third issue we are worried about, the long-term issue, is there's an increased risk of colon cancer. The colon is the large intestine. And the fourth issue, long-term issue, is very significant memory lapses. So these are the three main options available: herbal treatment, hormone treatment, and tibolone. I would say that these are the main things available in the world today. So I prefer to see a couple actually when they come to consult for menopause. Better I explain to both of them so both of them understand very easily, simple terms, what the woman is going through. Then at least the husband can help.
So if you don't feel right, don't ignore it hoping that it will go away. Don't suffer in silence. See your doctor. Remember, stay healthy, stay happy.